Hey everyone, Dr. Reis here. I want to talk about something super exciting today, breast augmentation. So this is one of the most common procedures that we do, super high satisfaction rating, but there's a lot of variables that go into this. So let's try to demystify that a little bit and talk about breast implant placement. All right, so real quick high level overview for breast augmentation. There's tons of different variables that go into it. We have the implant size, the implant type, the shape, where we're going to place the incision, where we're going to place the implant. So I want to dive a little bit deeper on actually the implant placement and where we're going to be putting that. So this is all dependent on the anatomy of the chest and the breast. You've got basically the skin, the glandular tissue under that, then you have the fascia that's supporting that over the chest wall, and then you have the muscle. All right, so the first option is the submuscular, or what's called dual plane. So you basically have the muscle on the upper portion right here, and then the implant sits right under that on the upper portion. So there are several benefits to that. There's several cons. So the major benefits of that are that you get excellent coverage of and soft tissue support. So there's much less chance of rippling or that kind of the wavy appearance that you see from the implant. Cons really are that it's under the muscle. That's not where the actual native breast tissue is. You're also defunctionalizing the muscle by having to cut the lower portion of it. So it doesn't work as well for people that are heavily involved in sports and activities. Additionally, whenever you flex, you can get this, what's called an animation deformity, which is kind of this interesting, sometimes odd appearance where the chest is moving and the implants are being displayed. All right, so the other main option for placement of the implant is instead of going under the muscle, going directly on top of the muscle. So there are many benefits to this. Instead of putting it under the muscle, or you're defunctionalizing, you're cutting that, it's going on top of it. So you don't have the animation deformity. One of the downsides though is you do have a more chance of rippling. So some additional major benefits of the on top of the muscle are, since the implant is closer to the surface, you get a better creation of the medial cleavage, so the middle portion of the breast as well as the upper pole fullness. You also, in many patients, especially that have had kids, that have breastfed, that maybe put on a little bit of weight and lost it, you get this descent of the breast. So you can potentially get away from doing a lift with an augmentation. And assuming you have the right size implant, you can be away with often just doing an augmentation and avoiding a need for a lift. All right, so as you can tell, there are many subtleties, many variables in breast augmentation. If you're interested in learning more, be sure that you're going to see and consulting with a board-certified plastic surgeon with both the training as well as the experience to guide you through this journey. If you'd like, give us a call at Austin Plastic Surgeon. We'd love to see you.